In the house. All right.
I know. Well, thank you so much for having me tonight, and it's always such a tough decision for me when people say, hey, you want to come talk about immunization? Okay. So it's a whole, I play hard to get. I give it a whole 10 seconds before I give, some sort of idea of if I want to do it or not, but I of course do. So I'll give you a little bit about my background. I am in the Department of Health Promotion, which is in the New College of Health and Human Services. I specialize in epidemiology, both undergraduate and graduate level, and human diseases. Epidemiology, how are you familiar with it? 2, 3, or 4, kind of? Okay, so, which is fine. So the easiest thing to say about epidemiology, she says, come on in. The easiest thing with epidemiology is that, to explain, is we're the CSI of disease. So, yeah, see, it's kind of cool then when you say it that way, because what we do is we look for cases, we look for signs and symptoms, we look for groupings, and then based upon all of those types of things, we try and determine what the disease is, how we can follow it in populations, and more importantly, or most importantly, control it and stop it. At the bottom of the screen here, you see a logo called EpiCore. EpiCore puts out a global map. It is a social networking reporting system that we use. If you've never seen the map has some real-time stuff, but every disease that's been reported to public health departments, you'll find on there. It relies upon people that are epidemiologists and other individuals in public health to find something in the media, vet it, and then send it to them. They vet it again and post it. And then you can find where the cases are. So it's a nice way that we can also learn how other areas are controlling disease and what we can actually do to abate that. So lots of options here. So I'm a member of EpiCore and I report diseases. Okay. So I think the place to start first is what the top 10 health threats are globally. So from the World Health Organization, you'll notice right away, and I'm hoping, let's see, I only have 1, 2, 3, maybe 3 people in here that might be red-green colorblind. Other than that, everyone else is good, right? Nobody's colorblind in here because I put this in red. Wasn't really thinking that through. I'm sorry. Really? Dr. Stringfellow?
No.
Oh, okay.
I'm fine.
Okay, you're good.
Thanks for caring.
Sure, I do care deeply. Okay. So they've released this list, and you'll see 2 things that stand out, hopefully. I'm assuming everyone can now. Number 1, air pollution and climate change. Non-communicable diseases. Number 1 disease that people die from in the world is, want to guess? No. Heart disease. So 1. Okay, so heart diseases, both in the United States and globally. The number 1 disease that infants die from in the world? No. Diarrhea. Which can be prevented with a vaccine. Yeah. That's the number 1 cause of death. So when I have people that are telling me all their intimate stories of their digestive tract and they think that they're dying, chances are you're not. So, you might feel like it, but you're not. Pandemic influenza. The last time we had a pandemic influenza outbreak was?
19.
No!
2009?
2009, which was the H1N1 influenza. And you may have remembered that. Yeah, maybe some of you hopefully got vaccinated. Yeah, okay. Crickets, good. That's a great. Maybe some of you got vaccinated.
I did.
I know. Everybody else is just slipping away from me right before my eyes. Okay. So, what we call fragile and vulnerable settings, war zones, places that are overpopulated. Antimicrobial resistance. We have a variety of things now that are antimicrobial resistant, and here's just a couple. Syphilis. We now have a syphilis strain that is antibiotic resistant. Chlamydia, antibiotic resistant. And gonorrhea, we have a strain of that, antibiotic resistant. We just released a report last week, or a report was released last week, that there is actually a bacteria that when it's in your esophagus, it's fine. When it gets to your gut, it can cause ulcers. It's called H. pylori, or Helicobacter pylori. And we treat it with an antibiotic, and it will make the ulcer go away. Most individuals believe ulcers are caused by what? Stress? That's not true. It's not stress and it's not diet. Over 90% of them are actually caused by bacteria. And we treat it very simply with a round of antibiotics, Pepto-Bismol, and usually some other, what we call a proton pump inhibitor like Pepsid. So that's what they have for it now, just those three things. But here's the bad thing. If you don't treat that bacteria, which again is becoming antibiotic resistant, it can lead to stomach cancer. So, you know, we're in a tough situation here with a lot of different things. So, of course, Ebola and other high-threat pathogens. I like to call Ebola the sexy disease. People are far more interested in Ebola, and they're more interested in the possibility of hopefully getting a vaccine for Ebola, which they're finishing up trials for that. But they're unsure if they should still get the flu vaccine. So we did a survey, one of my graduate students asking, what are the major concerns that you might have in Illinois and kind of central Illinois for health? What do you think our target should be? What is the disease that people really want to know about? So she started asking a whole bunch of people. And they said, you know the disease that I'm really worried about in central Illinois? Ebola. And they were serious. That Ebola. And that damn Ebola. In central Illinois. Okay. Noted? Right. This is the big one for us. And it's becoming a bigger deal because we're starting to see diseases that were listed as being gone are coming back. That's the reluctance or refusal to vaccinate. Oftentimes we refer to these people as vaccine hesitant, and they're also known as anti-vaxxers. Those are individuals who are usually very strong opponents of vaccines. Okay. It's like death is happening over here. That's why they're saying bless you. That's left over from the plague. Did you know that? There's your fun fact for the evening. Yeah, that's left over from the plague. So when people sneeze, we'd say bless you because we're like, you're a goner. Or we're just going to tell you now. That's what that's from. Dengue fever, which is a mosquito-borne illness, and of course the HIV epidemic is the other one. But let's get into why I'm here. And that's to talk about vaccines themselves. So vaccines have two purposes, right? Immunizations do. And what are those purposes? Protect ourselves and protect others. More importantly for me, how many of you have had the flu in here? I'm just curious. I won't ridicule you that much. Okay. And that means you also get the flu vaccine, right? Every year. Because once you've had it, you want to be put down. It's like an old Yeller film. Only a couple of you remember that movie, right? Do you know that? Isn't that a terrible movie? Yeah. So it's awful. People feel terrible for 14 days. Incidentally, though, there's a study going on right now at St. Louis University. They will pay you $3,000 to infect you with influenza, and then you stay with them for 10 days. I hope you don't die. Yeah, for 10 days. You're like, 3,000, like somebody's looking it up right now. I'm signing. I know, you're like, I've got bills. I get it. Yeah. But I've never had influenza. I've never had the flu, but I get the vaccine every year, and it's because I'm around a lot of people. And a lot of people don't get the vaccine because they say, you know what, I've never had the flu. Are you sure? Because 30% of the people that have it have no symptoms, but they give it to others. And they're giving it to others who are susceptible. So there's part of that, okay? So those are those two purposes. And with that, there's some things that we need to think about when we're protecting others, because this is really what public health is. It is not just protecting ourselves, taking care of our little niche. It's taking care of the entire public. So we have some really high-risk patients. I have a 2-week-old niece now. I know, so cute. So the whole family got their shots. I was so proud of them. They did it. I didn't have to drag anyone, which I have done to family members before. I have no shame. But she cannot be vaccinated until when? Do you know how long it's going to be before she gets her first vaccine? 2 months. She's already had one. At birth, all infants get hepatitis B vaccine. All infants that also, because this is kind of like a concern that people have when they're talking about infants and toddlers, is how much they're exposed to. Like, we're giving them a lot in vaccines, aren't we? But actually, when they pass through the birth canal, they're colonized with over 8 trillion bacteria. So they're colonized with that. They need it for their gut, they need it for their lungs, they need it for neurological development. So they've all been colonized with that. Individuals who are elderly, if you know somebody 65 and older, they get their flu shot. If they get their flu shot, it's going to be the high-dose flu shot. So there's that one that's out. They're more at risk. Why? And why are infants also at risk? Immune system. So as we get older, it's not as effective. When we're younger, it's just developing. So we're kind of, you know, for the rest of us, we're kind of all in between there. People who are immunocompromised, if they have HIV, if they have multiple sclerosis, there's a variety of, Kawasaki's disease, it goes on. There's a very long list of those particular illnesses. Also chronic health conditions, people who may be diagnosed with maybe chronic bronchitis or emphysema, the COPDs. We also, between immunocompromised and chronic health conditions, we also have like other high-risk conditions. Down syndrome patients have a flatter, shorter, broader nose. The respiratory tract is not as long as we see with a typical respiratory tract. So what that means is they're more prone to developing influenza, pneumonia, and other types of illnesses, respiratory illnesses. We also look towards individuals with different types of behaviors. Pica behaviors, putting things in their mouths. Yeah, some of you have heard that term before. We see that with infants, and we see it with people with a variety of disabilities. Okay. Onto the certain medications. A lot of medications that you see on the market today being advertised for, say, rosacea. You'll also see it being advertised for psoriasis. Individuals with rheumatoid arthritis, those are all people that will take medications, and even people that have had transplants, like a heart transplant, kidney transplant, lung transplant. They're all on medications that are suppressing their immune system. And they're suppressing the immune system because when the immune system is overacting, it's causing a lot of signs and symptoms, right? It's the immune response that causes you to feel as bad as you do when you're getting sick. So if you've been sick of late, and I know, so it's cold season is now. I don't know if you know that or not, especially for you around children. It's now. Well, actually, it's kind of all the time with children, but yeah. So we look in and encourage different types of behaviors for people. You know, things that I always suggest for not just vaccines, although vaccines provide us the best protection. Hand washing, of course, is one. Maybe clean your cell phone. When's the last time you've done that?
Recently.
The people I know did it 10 minutes ago. So when they come in and I ask that question, they're like, oh, today. Yeah. You should clean it every day, folks. Yeah. And all you need is like an alcohol prep pad. You know the ones I'm talking about? Like, yeah, that's it. Tear it off, wipe it down, let it air dry. That's it. You should do it every day. You cannot believe the things that we find on cell phones. MRSA, we found that. You know what MRSA is? Yeah. Methicillin-resistant Staph aureus. So that's one. We found that. We found yeast infections on phones. I have questions. I have lots of questions. Like, how? That's what I want to know. All right. So there's lots of things that we do. So keep that in mind. So, and hand washing is always a big thing. And with kids and people who have difficulty in learning how to wash hands, there's a way to do this. Dawn dishwashing soap. It's thick. They have to hold their hands under water for a long time in order to rinse it out, which means it increases the amount of time that their hands are being irrigated. Yeah, I know how to play these games. I'll figure it out. I want to know what happened to this room. Like, why is this side and why is something you all said? I mean, you know, they're all looking at you like, yeah, whatever. But then I got this today. Yeah, be sure you get a photo of this. And I need to post for this photo, right?
Get in there, I can't see you, okay.
So this is Dr. Hillier's husband. And you didn't ask for permission to use this because it's on a billboard in Champaign at one point in time. He works for the Public Health Department, and he actually is doing a campaign for the community immunity influenza vaccines. But then a friend of yours posted to this, and we did ask her if we can use her name. You want me to blot it? She said no, put it up there. For someone with a very compromised immune system, thank you. I know. Somebody was like, yeah. That was probably me. And that's me. It probably was me. I think the thing to talk about as we're starting to discuss a little more about vaccines is that to know how we become infected with illnesses. And one of those things to focus on is the chain of infection. So the chain of infection is how the disease gets to you and then how it gets to the next person. So we always start out with the infectious agent. That is the pathogen, whether it's a bacteria, or virus, or a fungus, and there's all sorts of really bad ones. There's parasitic worms, which I have in my office in jars, if you'd ever like to come by and see. I do. Do I not? I do. The reservoirs where the disease lives and where it develops. Then we have the portal of exit. Somebody blows their nose maybe, or they sneeze on someone. But a lot of times the things that make us sick are either respiratory, like as we're talking. If I had measles right now, came into this room, hung out for a few minutes, I don't even need to be here for 10 minutes, and left, those of you who are at risk of getting it would get it. It's a super spreader. It's super infectious, and that's why we're starting to see so many measles things that are happening now, because it's combined with not just how effective it is as a disease, it's smart. It really is. But it's also people not vaccinating their kids. That's causing the bigger risk. And it's not just a risk. I get that people, it's a very personal decision. I believe that all parents want to protect their children. But people do have concerns, and I think we need to take the time to address those concerns. I mean, it's worthy of noting. Okay. But the things that, if it's not just a cough, it's what we call a fomite. Fomites are surfaces. All the things you touch in a day. Think about it. As you clean your cell phone. Oh no, your glasses. What about the things you touch in a day, right? Doorknobs, right? Okay. Anything else? Keys? Bathrooms? Oh. Okay. What else? Remotes. Desks. Pencils, pens. You're like, geez. Okay, so does it really matter that we touch that many things? I mean, we do have hands. You would think we might use them. You know what matters? Touching our faces, our mouths, our nose, our eyes, our ears. How many times do we touch our face in a day? 3,000. 3,000. Once or twice? A minute? Everybody's like this. Yeah. Nobody's touching anything in here. I hear you. You got it. Yeah. So portal of exit, how it gets into us, directly, indirectly. I walked out of, walking into County Market one day, and some dude sneezed in my face. Oh. Do you know what that was like for me? I mean, honest to God, I was just, I thought, this is what it's like when you die. This is totally what happens. The portal of entry, and then, of course, the susceptible host. And for here, I show an infant, but the susceptible host can be anyone. Okay. In fact, in 1918, which was the largest pandemic that we had of influenza, killed millions of people, and the people that were dying from it were young and healthy, because they were having an overactive. All the people are like, I've got a great immune system, I never need to get a shot. They're also the same people who are like, I've got a great car, I'm a good driver, I never wear a seatbelt, right? Yeah, you know who you are. Yeah. And it's also the same people that are like, I think I'd rather have the disease, right, than get the vaccine. Well, that's like saying, I'd rather count on the airbag than wear the seatbelt. Even though you have to have the seatbelt on, they hit the airbag. Yeah, that's kind of it works together. It's funny how it works that way. Okay, so lots of things. But this is what we know. And this is what's really important. Two things with the chain of infection. The faster we can identify what the illness is, then we can actually create a solution to that illness, some sort of prevention. So that's one thing. Very fast identification. The second is the reservoir. If we can destroy or make the place where this disease is multiplying inhabitable, and we can do that through vaccines, then we can eliminate a disease. We already have. We eliminated smallpox. For those of you 50 and older, or born outside of the United States, you probably have been vaccinated for smallpox, right? I don't, okay. You were born outside? Yeah, okay. Yeah, so normally, like when we do blood tests for individuals, we can find a variety of different types of antibodies that they've made towards illnesses. So people who are born outside of the United States, a lot of times will get a TB test here in the U.S. and they test positive because they've been vaccinated for TB. We do not vaccinate for tuberculosis in the United States. I have lots of ideas on that. And I'm happy to share them in another time. But if we can eliminate that reservoir, then we can eliminate the disease. Okay? But there are a lot of bad feelings on vaccines, right? Yeah, and it's painful for me and for some, and then I think really as a whole it's painful to make a decision that I think that people look at so personally. But this isn't new. The fear that we have of vaccines is not new. In fact, this is one of my favorite cartoons. Excuse me, my gin's getting low. This actually, the title of this cartoon is called The Cowpox, and it is from 1796. In 1794, there was a gentleman by the name of Benjamin Jesty who noticed that his milkmaids had blisters on their hands that were full of pustules. They call them pustules, full of pus. And as he was looking at them, he also noticed that none of them ever got sick from smallpox. So he thought, I'm going to take a little bit of that pus and scratch my family's arms, yeah, and put a little bit of that in there. Yeah, so they had a little mild reaction, and they recovered. None of them ever got smallpox. So in 1796, Jenner's like, that's brilliant, and has created the actual vaccine for that. So Dr. Edward Jenner, who this is, and he doesn't look anything like this, but you'll notice some features about this. So we are telling the public that we have discovered a vaccine by taking the pus from cow pustules and letting it dry and then adding it to a solution and then scratching your skin and adding it to that. And then you won't get sick, but we're going to put cow pustule pus on you. Now how do you, okay, just by the looks on some of your faces, you're horrified at that whole cow pus thing. Right? It's not like we're lining up. I mean, I did for smallpox vaccine. They took us to the basement of the music room. They came in, they went by classroom. They took us all to, I'm still convinced they took us down there because they couldn't hear us scream. That's really where they took it. It's like a dentist that had like special soundproof rooms in the back. And as I'm walking back there, I'm thinking, oh, so this is how it's going to be today. Some people were horrified. They had this idea that if they got this vaccine, they would produce cattle. Cattle would fall out of them. All right, let's go back a little bit more. Like, wait, what? Okay, so we actually have gone through a variety of eras in medicine, right? So we have this spiritual era in which you're sick because you sinned and you're a terrible person. We have that era. We also have this era that pretty much is along the lines of tiny gnomes growing in your stomach. Yeah, and we also had what we call calabrious birds. Calabrious birds were pigeons in a cage, and they bring it up to you and hold the cage up to you, and if the bird looked at you, you were going to die. solid diagnostic tool. Solid. Yeah, so if the bird looked at you, you're going to die. Okay, so you can see where people might think that cows are going to grow out of their arms, fall out of your mouth. There's a couple in here. Oh yeah, out of the ear, all sorts of things. So it's not new. It's not a new attitude that people have. But this is what happened as a result. We started to see with this smallpox eradication that there were two final cases. Australia here, you'd think, oh, there'd be a lot more cases. Like, why are they done? Part of it is just simply because not a lot of people traveled very far into Australia. So they were able to kind of control the cases. The last known case was actually October 12th, 1977, and that was in Somalia. And it was actually a healthcare worker. They had gathered people from the World Health Organization and the Centers for Disease Control and Prevention and said, let's go vaccinate people. And they packed up vaccines and they traveled globally. They went to schools, to streets, trains, all sorts of transportation, and they just vaccinated. Have you been vaccinated? Have you been vaccinated? And they vaccinated them. And they're doing one thing that worked really well here, and it's called herd immunity. And maybe you've heard of herd immunity, herd immunity? Okay. So, but this, how many of you have that? Yeah. So that actually came from the injection gun. So there was a little injection gun that they had. It was needleless, didn't have any needles in it. And it ran off of an air compressor. There's two air lines right there. And you rolled up your sleeve and we walked up and they just gave us a little injection and walked on and we got chocolate milk. That's right, we got chocolate milk for that day. That's, you know what, that's a two snaps up kind of day.
We didn't in Turkey.
I'm sorry?
We did not in Turkey.
Did you have coffee instead? I mean, that would be, well, nothing.
I feel chips.
Well, you should. You really should. You have been cheated. I'm sure there's some paperwork we can fill out on that. Let's work on that. So the World Health Organization in 1980, they declared smallpox as dead. It exists in two places in the world. Centers for Disease Control and Prevention in Atlanta, Georgia. They keep it in a freezer there. About every 10 years it comes up and they're like, geez, should we destroy it? We should probably just destroy it. And then when it comes right down to it, they're like, let's keep it. If you keep it and if it comes back, then we have something to make the new vaccine from. So they're like, I don't know, it's like too good of a sweater. You can't quite get rid of it. It doesn't fit, you don't wear it, but let's keep it. So it's a little bit like that. So, yeah, we were able to keep it there, and then it's the other place it's located is Russia. Okay. Are not. This is one of my favorite things. I like to answer lots of things with this, are not. So, are not is actually a predictive value. So we have a formula for how we can predict disease and how it will spread in a population. And that's what R naught is. Sometimes you'll just see it as R sub-zero, R naught, and sometimes R. It doesn't really matter for the purposes of this evening, but I want you to know that there is a tool that we have that can predict the spread of a disease. And this tells us like how virulent or how contagious the disease is. So we look at a person with the disease and then we say, based upon the number of people at risk, this single person that is infected will infect this many additional people. Okay? Here we go. Some of you need glasses. See that, or I need to make this much bigger. All right, so Ebola, Ebola in central Illinois. And we're thinking of like the number of cases. So one case of Ebola will, at a maximum, cause 2 additional cases. Okay? Pandemic influenza, 2 to 3. HIV, 2 to 5. Mumps, 4 to 7. We've had mumps outbreaks in Illinois. Do we have measles in Illinois right now? Do you know? Yes. Trick question. Trick question. It's about vaccines. 5 to 7 for smallpox. Measles, 12 to 18 people. So for every one person that has measles, they can infect 18 additional individuals. Just from like me being in the room. It's really infectious. And we vaccinate for measles with the MMR. That's the vaccine that a lot of people are saying, no, I don't want any type of vaccine or any type of toxin or stuff like that. Okay. All right, my favorite, herd immunity. I grew up on a farm, and it was a blast. We had cattle and we had horses. And actually, I've always called it a farm, but I've been told many times that it's not. It's a ranch, because we didn't have chickens. I didn't know that was the qualifier. So, but now I've been schooled, and I probably look smarter because of it. So, horses, cattle, but we had to vaccinate the cattle. Horses were easy, but the cattle, you know, it's not like we hang out with them and hug on them every day and love on them. But what we would do is we would put them in a shed where they actually would sleep at night, and we'd put down some bales of straw, because we'd also use it as a time to kind of spread straw for their bedding. And then we'd get a couple of them running in a circle. You just kind of tap one and one will start running, and then they all start running in a circle. So then we have a person giving the vaccine, not me. The person pointing at the one that needs to be marked, still not me. The one with the livestock marker that when the cow runs by, you reach in and you mark it really fast that it's gotten its shot, and you hope you don't get kicked. That was me. Yeah, previous, because I have a brother, that's why. So you want this? I can do that. Please don't kill me. Yeah. So what we were doing, and maybe we would miss a couple, and that was okay. You can miss a couple. I mean, what we need is about 97% of our herd immunized. That's true for disease. So if we can get 97% of our herd immunized, okay, we're done here. And then I could stop being kicked at, and I could take my marker and go away. It's not a marker, they're liars. It's like a chalk thing. But I want to show you this, especially in a time frame in which people are saying, I don't know if I really want to vaccinate people. These are how many flights occur in the world every day. 205,000 flights a day in the world. That is 12 million passengers. 2.7 million passengers are actually in the United States. So, think about how much people travel. When's the last time you've been on a plane? Spring break. Spring break. March. March, September,
July.
Yesterday, 2 days ago? 2 weeks ago. Okay. And I bet you just love flying, don't you?
No.
Why is that?
Because I think of bacteria.
Because I have ruined you. That's why. We all know that to be true. I have ruined you. And most everyone I know with this kind of, yeah. So, you know, you go in there and you're like, do you want to touch anything?
No.
And then you're like, geez, I can't wait to use the bathroom. It's my favorite part of the ride. Right? Yeah. Because incidentally, we say somewhere around 30,000 different bacteria are at on the floor by a public toilet. So the next time you put your book bag down, or as I once saw somebody put their cell phone down on it. Yeah, that was the face I made, but then I did this. Oh, yeah. Like, oh. That's it. So, but this is how it works. This is herd immunity, and this is a little bit kind of what I did with cattle. Is you have people that are orange here, and they're individuals that are contagious, and the other people are susceptible because they haven't been vaccinated. So that can very quickly, depending on the disease, infect a population. But if we have a population that's immunized, which is this little blue, then we're actually protecting the most vulnerable in the population. But again, you know, when you think about influenza, 30% of individuals that have it don't show any signs or symptoms. They're actually going to infect others. And if anyone has a cold in here, or is getting a cold, when you first felt that little tickle in your throat, you've already been infected for 48 hours. You're like, you're ruining my life, lady. It was just kind of a, okay. Or is that like, my roommate's going to pay? Okay. Somebody's going to pay. So this is just a little bit more of a different type of comparison. We have, you know, the blue section here, not immunized, but they're healthy, versus people who are not immunized. And then the orange, when we actually kind of pepper them in. And again, the more that we can get into a population, we prevent individuals who are at risk from getting those illnesses. And you have to look back to people with compromised immune system, people with disabilities. You're looking at transplant patients. You're looking at the elderly. You're looking at infants. I mean, it goes on. Anyone who takes a medication to suppress their immune system. All of that is in there. Okay? And this is kind of where it's led us now. So, this is the number of measles cases reported by year. In 2010, the Centers for Disease Control and Prevention said, we're going to be done with this. We're absolutely going to be through with this. We're not going to see any more cases. It's going to be a matter of time, and we're going to say, it's dead, gone dead. And then we saw a spike. We were like, oh, geez. And then we see, 2012. And then we see this huge spike in 2014. This is the year that Walt Disney World, or Walt Disneyland, I'm not sure which, was it Disneyland? Does anybody know? It was Disneyland. It was in California, right? Is that Disneyland? That's it, okay. They had a child that had measles and went there and infected a bunch of people. And because it's a vacation spot, people got on planes and went home. So it just kind of built and built and built. And then in 2018, we see this 372, almost predominantly from an Orthodox Jewish population in Philadelphia. They are anti-vaccine. So 2018, 372 cases. The leading problem that we're having, first, this is as of October 3rd in the United States, 1,250 cases. And again, it's the hesitancy that's really putting us in that position. If anyone has ever seen an infant or a child or even an adult with measles, it's pretty bad. When you have a fever, you don't feel good. They have a fever, they have a rash. That fever can get so high it can cause swelling on the brain, which can lead to death. So it's really scary, and we have had people die from measles in the U.S. this year. In the first 3 months of 2019, we had already surpassed the 372 from last year. And this is just in October. We have no idea. It'll probably start to lose steam. All diseases do one thing. I had somebody tell me, they were talking about the plague. And they're like, that disease, it went away. We didn't have vaccines, yes, and it killed 1/4 of the world's population. Wiped us out, just 1/4 of us. So what happened? It ran out of fuel. It's like, we don't have anywhere else to go. We've either killed everyone or infected everyone, and the disease dies out. I don't think anyone wants that chance, though. We're not like, let's see what will happen. Yeah, it's not on my bucket list. We should have a bucket disease list, don't you think? Like things not to get. All right, so these are states with the cases. Illinois is one of those. Okay, so where are the cases coming from? It's hard to tell at this point. So we're going to look for a couple of things. One of those individuals is called patient 0. That's the person who started the epidemic. But we also have what we call the index patient. And the index patient is the person that was brought to our attention first. They're not necessarily the person that stopped the epidemic or started it, but we're able to locate them. Okay. All right. So vaccines do work. In the 1900s, the #1 cause of death in the world and in the United States was infectious disease, mostly diarrheal diseases. But look at measles. Can you see that number? You want me to see if I can make that smaller? It barely has texture back there. Yeah. So if we look at smallpox, at one point 29,005 cases, now none. Pertussis, and there are cases of pertussis. What is that? Yeah. Whooping cough, also pronounced whooping cough because of the sound it makes. So you'll hear both. You have dogs? Anyone? You vaccinate them? Yeah, so they're vaccinated for kennel cough. That's a pertussis. So what happens here is that children cough so hard, the reflex, that sometimes they'll rupture blood vessels in their eyes at the surface level. We see that sometimes people cough really hard or maybe throw up really hard, or sometimes it's spontaneous in people. So they have that. Their mucus is so thick they cannot breathe. And some of them actually do die from asphyxiation. They suffocate in their own mucus. Where do most of the kids get those cases from? Adults. Adults. If you are around babies, if you are around infants, if you are around children, if you are around people with compromised immune system, if you are human, I just consider getting the DTaP vaccine. That's diphtheria, Diphtheria we used to call gray throat disease. People would develop this gray plaque on the back of their throat. They also would choke. So that is in there. Tetanus. Everybody knows what tetanus is, right? Because I always tell you, if you like poke yourself with something rusty, why is it always rusty? You poke yourself with something rusty, and it might have, feces on it. Like, from what? What is happening here? Yeah. So, but that causes lockjaw. Yeah. So it's just a series of vaccines. But as adults, we carry it, and it's important that you get vaccinated for it once every 10 years. I mean, that's an easy vaccine, right? Because influenza, you have to get it how often? Every year. And it lasts for how long? 6 months. Mm-hmm. Yeah. Yeah, the vaccine itself only lasts for about 6 months. That's why it's kind of important to bide your time. So when is flu really active? November. So usually like the second week of October, I'm like, people go get your shots. And then Dr. Hillier gets hers and comes and says, I got my shot, and rubs it in. Yeah, that's all right. Yeah, so that'll last for about 6 months. But here's the thing about all viruses in general, and it's especially true with flu, is that these are illnesses that have this really clever mechanism that's called drifting and shifting. And if you think of a virus that's hanging out at a casino and it's just pulling the slot, each time it comes up, it's like, oh, look me, I'm a new strain. That's exactly how drifting and shifting works. It's just someone pulling the slot. Okay? So it takes us a long time to find the actual vaccine that works, especially with influenza. It's like a 6-month process. And we don't always get it right. But what we know is that even if you get an illness and you're vaccinated, it won't be as severe as it would be if you didn't have the vaccine. So that's something to consider. Okay? And then, of course, here's today, and it was down to 61 cases in 2010. All right. This is just the coolest little slide. I saw this today, and I stole it. I don't remember what from, but now I feel super guilty, so I'm going to have to go back and look for it and give credit to it. So I want to talk a little bit about myths and realities, though, and that's the big one, right? And some of you are like getting paper bags out now to breathe in them. Yeah. So there's two things in vaccines. One of them is thimerosal, that is a preservative. That has not been in infant vaccines since 2001. It's been a long time. So it's not in those vaccines. Aluminum is in the vaccine, but it's an aluminum salt. And the salt is actually, when you look at table salt, that comes from a metal. So this particular salt, aluminum salt, is something that our bodies absorb. It actually causes our bodies to have a stronger immune response. Our bodies already have between 50 to 150 milligrams, every single one of us, of aluminum in it. Breast milk has 8 milligrams. Formula has 30. An infant will get 4 milligrams of it in the first 6 months of life through vaccines. That's it. So it's nominal. Okay. Immune systems can't handle so many vaccines. Well, fortunately, these vaccines are not like how they used to be. When we used to get a vaccine, like in the 70s and 80s even, that thing was just loaded up with proteins, so we get a big dose. Now we get much, much smaller doses. There are 14 vaccines that an infant gets within a time frame. If they did all of those 14 vaccines at once, and how these vaccines are designed, their immune system that will respond is only 0.1%. It is so minuscule. The vaccines are so much safer now than they have been. So it's a very, very small amount. And again, the trillions of bacteria they're exposed to through the birth canal. Natural immunity is better than vaccine-acquired immunity. Would you say it's better to have a migraine headache or to treat it? Yeah, or better not to cast an arm or let it heal on its own. I guess it depends on what you want to do. Yeah, so what we know is that when you have an immune response, you have a fever. Sometimes it'll cause some nausea, some vomiting, body aches. There's a variety of different types of things that happen, and it's extensive. And that in itself is another night altogether. But probably one night is enough for you with me. This isn't one I hear a lot. So we have better hygiene. That's why we don't have as many diseases. We've had the same level of hygiene today in the United States that we did in 1963. There's nothing different. I mean, there's different infection control in hospitals, different policies and stuff, but as a whole, hygiene hasn't really changed. So by saying that we just have better sanitation is not really a valid response to that. Okay. What about this one? Oh yeah, I get this one a lot. Dr. Simons, I don't get the flu vaccine because it always makes me sick. I always get the flu. You, my friend, need to call Guinness Book of World Records. They're going to be impressed that you got a disease from a vaccine that didn't have a live disease. So it's dead. It's in the vaccine itself, the flu virus is. But with a lot of our vaccines, it takes 2 weeks for you to develop immunity to it, to develop those antibodies. So if you wait too long to get a vaccine, especially with flu, you're at higher risk of getting it. We vaccinate year-round for influenza now. But if you're an individual that has had pneumonia in the past, has had influenza in the past, or other type of respiratory stuff, we do recommend that you get a vaccine, a flu vaccine. So there's that. Do you guys have any questions? No? Okay. You will have a little mild, a lot of people have a mild response, like a little redness at the site, right, when you get your vaccine. Sometimes people get a little soreness. If you've had the tetanus shot, yeah, you're like, what the hell? Yeah, it's sore, isn't it? You're like, I need to reach something up on the, you just can't get there. Yeah, it's tough. So you get a lot of muscle soreness with that. There's a lot of inflammation. It causes, that inflammation causes pain, it's pushing on nerve endings, and until you've had that in your system for a couple days and it starts to settle down, you'll start to feel better. But a localized reaction is very common. Now, there is a vaccine reporting system that exists. Anyone in the United States can report to it. So if you think you've had an adverse effect, go online. It's through Health and Human Services, hhs.gov, and you can find a place to report an adverse reaction. And they take everyone. They take everyone because it helps us to kind of go through the list and see, okay, is this common type of things that they're experiencing? A little redness at the injection site, maybe something that's bad, or along there, oh, their children were born with the heads of golden retrievers. Okay, that's an adverse effect. That's something we're going to want to look into. Okay? All right. So, but isn't this great? I love this photo. But if we look at infants and children born between 94 and 2018, right? If those that are vaccinated, they'll prevent 419 million illnesses. That's 26.8 million hospitalizations. So to be hospitalized, because it's all our favorite thing, right? Yeah. Oh, it's on my list. Yeah. So hospitalized. That's one thing. To miss work, I don't know. I kind of have a fun workplace. I kind of have to say that because they're here. Yeah. But look at the number of deaths, 936,000 deaths from vaccine-preventable illnesses, and then we're looking at how much we're able to save, 1.9 trillion in total societal costs. That's healthcare, and of course, you're looking at housing and everything else that fits in there. Yeah, so lots of things to take into consideration. Okay. I only have one more for you, and that's this. I love this. So if you're around kids, if you're going to work with kids, download this app to your phone. It's called Vaccines on the Go. It's both in the Apple Store and in what? Google Play? Is that what that is? I don't have an Android. Help me out here. Thank you. Something, something. Children's Hospital of Philadelphia puts out this app. It's called Vaccines on the Go. You can look at vaccines, when they prevent, when the scheduled vaccine should be given, the safety, there's education, you can chat with them. There's just really good resources there. So, I mean, consider that. I have it on my phone just because I think it's fun. Yes, that's the kind of person I am. I also have a game on my phone called Pandemic where I get to wipe out the entire world with a disease. Love that, isn't it? And I get them every time. I'm like, you're dying. You're going down. Yeah. Do you have questions for me? You do?
Oh, no.
I'm not leaving
I
him.
have my game.
You what?
I have my game. Yeah.
The pandemic game.
Oh, the pandemic game. I love that game.
My sister loves it.
Yeah. It's really hard to get Madagascar.
I know.
Yeah. So I kind of start down there, I'm like, oh, so you're isolating yourself. I see how you are. Yeah. Oh, yeah, they're tough to get to. I'm like, oh, man. That's when I just end the game because I'm a sore loser. I'm taking my ball and going home. Done with you. You're dead to me.
Thank you so much for this valuable knowledge. What happened in 1963 that was maybe a breakthrough with sanitation? You said nothing really standardized changed since that time. I was just wondering what happened right about that there that did it.
Yeah, a lot of the sanitation that we had in that time dealt more with living conditions and also trash removal, like the infamous, we got rid of open dumps. So we used to have open dumps in the United States where we'd just take trash and just pile it out and throw it, and then it'd get taller and taller, and then they were like, oh, geez, we've got a lot of rats. And it turns out they kind of like, to carry disease, and they do so really easily. So then we said, sanitary landfill, we're going to dig a hole and bury it instead. So that was one part of it. The other part is we looked into different types of chemicals to control mosquitoes and mosquito-borne illnesses, and then we looked at different ways to handle water. Yeah, so that was really the only thing that's changed, and we've pretty much stayed in line with those things. People are looking at their watches. I feel I need to look too. Like, what's happening? Are we going? Is it the snacks? It's the snacks, isn't it? Yeah.
No, I didn't know when you said the bacteria through the birth canal. I didn't know if you meant like if you're related to someone with like
Nope.
TB or
just regular bacteria and completely normal. That's how much we're exposed to in the birth canal.
Okay, so like what vaccination do they give the child for that?
They don't get one for that.
Oh.
Yeah. Yeah. So, it's a normal process. Yeah. You may have heard when I was talking about the vaccine they get at birth, which is for hepatitis B.
Okay.
And that's for a bloodborne pathogen. So they get that. Yeah.
I just connected the two like right.
Yeah. Oh no. I connect a lot of things up here, and most are wrong. I'm just hoping I'll find my way home tonight. Help me, okay, thanks. Yeah.
Do you think, like, in our lifetime, there's going to be a law that you have to vaccinate to, like, be in public spaces and, like, be in public schools and whatnot?
It's going to take something big to do that. Certainly, public health departments have the ability to, as do school districts. We're seeing a lot of school districts now. A former student of ours, Angelina Montleon, said the school district that she works for now is all your kids have to be vaccinated. Illinois is looking into changing some of the vaccine exemptions. There's lots of states that are vaccine exempt. They do it on personal beliefs or religious grounds or medical. So they're looking just to go to medical. But do I see it happening? Boy, it'll be hard.
Is there certain places that you, like some public schools, that you have to have certain vaccines?
Yeah.
Like you have to have certain vaccines to go into high school?
You all have to be vaccinated to come to college, to register for. In fact, when I did my undergraduate, I had a physician that was very elderly in high school, got my vaccines before I came to college, and then he died, and medical records were difficult to find, so I went on to graduate school, and they were like, you need to provide medical records. I'm like, I know, okay, whatever. So I just went and got another MMR. And then when it came time to do my doctorate, why not? I'm not going to look for my records. I'm going to do it again. They're that safe.
When I was in college, I'm old. I was born in '65. A lot of people,
don't take that from her. Don't take that.
A lot of people my age. That was right when they were shifting from dead vaccine to live vaccine on some of them. I had a lot of friends who their sophomore year of college had to have their entire childhood sequence of immunizations again because they had a type of vaccine that it was found that the immunity ran out. And so they just had to have the whole series all over again.
Yeah. So for all of us that have been vaccinated for smallpox, it's not working for us anymore. It was just for that I know. How long ago was yours?
12 years ago.
Yeah, 12 years ago. So.
2006.
Okay. Yeah, you're probably still good.
Yeah.
Let's take a trip to Centers for Disease Control. Let's go.
Let's go.
Yeah. So yeah, we don't necessarily have that protection anymore, but, you know, we had live vaccines or that had live material in them. We had ones, of course, with the dead material in them, which is what the flu vaccine, a lot of the other ones have. Incidentally, because of that whole smallpox, cowpox thing, the Latin word for cow is vacca, and that's where we get the word vaccine. How cool is that? There's your Trivial Pursuit thing. I know. You're like, that's the most interesting thing you said all night. Well, I'm also a Gemini, so. Oh, wait. Okay. Oh, noted. Yeah, noted. Yeah. Was there one more question? Nay? I believe I'm done.